Thank you, Dr. Stark. So I will be presenting today with my partner, and her name is Krista Roach. Am I sharing?
We can see you.
There you go.
Okay. Okay. So today I'm going to be talking about the Kentucky Racing Health Services Center. And before I get started, I'm going to give a little information about this slide. This is our logo. And when that was designed, it was designed by two daughters of two faculty members, and one was in graphic arts and the other one was in arts. And so we put those two talents together and came up with our logo with the horseshoe and the stethoscope. So a little history about our logo. So who we are, the Kentucky Racing Health Services Center is a not-for-profit healthcare center, and we were established in 2005. And this is a partnership between the University of Louisville School of Nursing and the Kentucky Racing Health and Welfare Fund. So we are a primary care center. We're a faculty practice, so all of us have appointments at the university, and we're what we would call a nurse practitioner managed practice as well, meaning we handle everything within our practice by nurse practitioners. And these are our providers. I am the director of the center. Krista Roach, who is with us today, is a family and women's health nurse practitioner. And we have two part-time providers, Dr. Karen Turner, who's also women's health and a certified midwife, and Dr. Batcha, who is a psych mental health nurse practitioner, and she provides our mental health care services. And then we have oversight by our associate dean of Dr. Whitney Nash. And this is our team, and here we are with our Derby theme at the Kentucky Racing Health Services Center in one of our exam rooms. Here are the full-time providers, the part-time providers, and then these are the services that we offer. So we provide primary care, which would include well visits, chronic disease management, as well as urgent visits. We also provide women's health services, and that would include all the annual exams, preconception, as well as family planning and treatment of STIs. And within mental health services, Dr. Batcher, she treats along the spectrum, a lot of anxiety and depression, substance abuse counseling, ADHD, as well as other psychiatric conditions. So our key community partner is the Kentucky Racing Health and Welfare Fund. And so that is a not-for-profit benevolent organization who provides the funding for our operations as well as the nurse practitioner salaries here. And that money actually comes from uncashed pari-mutuel tickets at horse racing tracks. So what that means is if someone has a winning ticket and they don't cash that ticket, then that money is actually gone into a fund, which is managed by the governor and funneled back to the Kentucky Racing Health and Welfare Fund. And that is also managed by a board of directors who are also appointed by the governor. Within the Kentucky Racing Health and Welfare Fund, the patients that we serve also have other services that are offered to them in terms of medical benefits. They can have physical therapy, chiropractor. There's a funeral benefit, a dental benefit, eyeglasses, as well as a retirement program. So it's a pretty comprehensive package. So last year in 2020, which was a year to remember for us all, we had about 1,016 encounters. And in 2019, we had like around 1,500. So we were down about 30% from 2019. And the national average decline on primary care visits last year was down 21%. So we were actually a little bit above the national average. And that's probably related to our migrant population. And then I have presented with you how our expenses are averaged and how we're able to benefit our community partner. So the national average visit of a primary care visit in a private practice would run these patients about $445. And with our approach to care and management of our funds, the Kentucky Racing Health Services Center, a visit with us is around $178.42, which is about a $266 cost savings. And so we're able to save the fund about $271,000 a year on that alone. So in addition, the patients that we serve, if we weren't here to provide this center for our patients, and if those patients ended up in the ER because they're uninsured, then a national average ER visit is around $1,093. So potentially saving either the state around $1.1 million, because if we didn't have this center, somebody's going to have to provide this care for our patients. And one thing I love to always talk about, the patients that we serve are backside workers. And so if we can't keep these patients healthy on the backside and provide this phenomenal service to them, no backside, who make it happen, no derby. So we always like to kind of emphasize that. In addition, another impact on our community partner are translation services. And so we provide, last year, or in 2019, we provided over 900 hours of translation services through the Latin American Studies Department, with students completing internships with us. And so the national average per hour for interpretation services is around $75. So as the community is $1,500. So this is the most precious part of our community engagement project, and that is our patients. So the patients that we serve, our target community, these are patients that work on the backside at Churchill Downs. So they are uninsured. This is what we definitely would call an at-risk population with many health disparities, lower socioeconomic status. About 85% of them are non-English speaking, primarily Latinx immigrants, with lower health literacy and literacy rates. And here's some pictures of the backside. Some of our potential patients providing, taking care of the horses. So our impact on the target community is huge. So last year, again, we saw 333 patients, and we're here Monday, Wednesday, Friday, 10 to 4. And that came out to 1,016 encounters, which would be about 3.2 visits per patient. And the male to female ratio is essentially split. Our average range, the most prevalent range is that 31 to 40-year-old person. And that's kind of important because that's when we start to see those primary care issues start to happen, when you start to see hypertension, the numbers for diabetes start to climb. And so that is a huge emphasis for us, because if we can target that age group and keep those patients healthy, we can stay in a primary prevention mode rather than to move to disease management. So within the Latino population, there's some things that they're disproportionately affected by, and that's diabetes, hypertension, as well as elevated cholesterol. So about 11% of our patients do have diabetes or pre-diabetes. And the measurement that we use in practice to say if we have good control is what's called an A1C less than 7%. So 67% of our patients have an A1C of less than 7%. So that's pretty good. And about 25% of them have hypertension and 30% have elevated cholesterol. So last year, we e-scribed over 1,400 prescriptions to this community, about 121 imaging referrals, as well as 750 labs. Now, keep in mind, this service that we provide for them, these patients are seen for a $5 copay at our practice, and then the Kentucky Racing Health and Welfare Fund covers these additional costs and imaging and labs and any referrals that we need to make outside of our practice.
Okay, so I'm going to share with you all.
You muted your speaker, thank you. My screen. Okay, So I'm going to carry on with the presentation and discuss about our community partners. And specifically within the university, we have partnerships with the School of Nursing, Dentistry, and the Latin American and Latino Studies programs. With the School of Nursing and the undergraduate program, we rotate about 100 of those students through annually, and these students are rotating through their community or global health clinicals. And the activities and projects that they work on while they're here in the clinic and helping service the patients, it does help them to meet the clinical objectives of their course. This could look like anything from hands-on help with administration of immunizations, or even a YouTube video to share with our patients. And I'm trying to advance the slides and it's not advancing, so it'll probably go 4 slides deep in just a second. Okay. All right, and this is an example of an undergraduate work where they developed a pamphlet to educate in both an English version and a Spanish version, gonorrhea and chlamydia prevention, treatment, and how they can lower the risks. In the School of Nursing, we have a Doctor of Nursing practice relationship as well, where those DNP students rotate through to complete clinical training hours while simultaneously focusing on their DNP projects. And their projects are based on evidence-based practice change that we often incorporate here into the clinic. And many of those are disseminated on a local and national level as well. And this is just an example of one of our prior students' work titled Educating Primary Care Providers on Assessment of Herbal Supplements Used by Latino Patients. And the School of Dentistry's partnership is with the General Practice Dentistry Residents, or GPRs. And the GPRs rotate through to learn to practice interprofessionally with the DNP students and the nurse practitioner staff here at the clinic, refining their history-taking skills while caring for those medically complex patients who have oral systemic health needs. And as we know, the Latinx population does have a disproportionate of unmet need for oral health care services, so they're an essential component to the care for our patients. This is just one of our former DNP and GPR students. And that third university partnership with the Latin America and Latino Studies program invite students to complete internships through the clinic. And while they're perfecting their conversational skills, they're also helping us interpret with our patients so we can have effective care given to our patients in a language that they speak. They also help us transcribe several things. Maybe that's translating that pamphlet from English to Spanish. And as Dedra mentioned earlier, we in 2019 had over 900 hours of language services provided by this program. And this is, again, some former students of ours from the BSN undergraduate program and the LALS program. Some community partners that we work with are the Backside Learning Center, Churchill Downs Recreational Center, and the chaplaincy program at Churchill Downs. Specifically with the Backside Learning Center, they are an independent nonprofit organization, and their goal is to provide educational opportunities and resources to empower the equine workers and their families. So we like to team up with them to further that mission and to continue to provide good health care to our patients through annual health fairs. We do educational seminars, and most recently we switched to a virtual format in their Facebook Live on the Backside Learning Center's Facebook page, providing COVID vaccine talks, and we had over 2,000 views with those. And as many of you all have changed to online format, this is what our lives have looked like in the past year. Prior to COVID, on the left, we had in-person educational seminars with our patients and families. And then, of course, post-COVID, things have looked quite differently. And with COVID, the impact on us is much like it has been around the world in any primary care setting. We had to initially close for about 6 weeks just to get everything, all our ducks in a row, to really just rearrange our workflow. How are we going to function on a day-to-day basis, triage our patients, schedule our patients? There's a lot of changes that had to be made. We were able to reopen in about mid-May. We did implement telehealth services for our patients whenever possible, and all of those translation services were moved to a virtual format. And COVID testing in our patient population between June and December showed a positivity rate of around 52% who were positive for COVID-19. Unfortunately, we learned that one of our patients did pass away from the COVID-19 virus. Talking about telehealth, in telehealth, it's not a clear-cut solution. There's definitely some hoops to jump through and some challenges that we encountered, but overall, we did a really great job trying to reach our patients and ensuring they had continuity of care. There were some data limitations. Some people didn't have the cell phone data coverage. Other people didn't have internet connections to support a virtual visit. And there were also concerns with lack of trust, or maybe that they were concerned if we would send them for COVID testing, they may turn up positive, and then they had a fear of losing their jobs, or even worse, possibly being deported. All of that is to say, all the work that we've done has been very graciously, we accept the honors who people who have recognized our great work with our community, and we are honored for that. That we did receive the 2020 exemplar recognition from the Kellogg Foundation, which we are so grateful for, and as well as today accepting the University of Louisville Community Engagement Faculty Award. Other recognitions, as you can see, we were featured in O Magazine in 2018, and other recognitions around the nation as well and locally, with many presentations, both from the student perspective and the faculty perspective, to share the work that we do with our community. And that is it.